So good day everyone, my name is Cristal Elazamay Singanan and I will be reporting about epistaxis. Epistaxis or nosebleed is the bleeding from the nostril, nasal cavity, or the nasopharynx. So most commonly the site is the anterior septum, where the three major blood vessels enter the nasal cavity. These are the anterior ethmoidal artery on the forward of the roof, the Kesselbach's plexus. Next, we have the sphenopalatine artery in the posterior superior region, and the internal maxillary branches, the plexus of veins located at the back of the lateral wall under the inferior turbinate. Next are the types of epistaxis. Anterior epistaxis are more common and less severe. They are easy to control, mostly occurs in children and young adults. Mostly the cause is trauma. This can be mild and can be controlled by local pressure and anterior pack. Next is the posterior epistaxis. These are less common but more severe. Difficult to control, occurs at 40 years of age and above. Spontaneous, often due to hypertension or arteriosclerosis. Bleeding is severe, requires hospitalization, and nasal pack is often required. Next are the causes and risk factors of epistaxis. So for local causes, we have trauma, infections, vigorous nose bleeding and nose picking, facial traumas, nasogastric tube insertion, a foreign substance in the nose, and deviated nasal septum. Next for coagulopathies, or the problems with blood clotting mechanism, thrombocytopenia, or platelet dysfunction, liver disease such as hepatitis, alcoholic cirrhosis. Next for the environmental factors, dryness due to continuous oxygen therapy, atmospheric changes, high altitudes, and sudden decompression. For the medicinal factors, we have anticoagulants such as aspirin, warfarin, platelet inhibitors, which is very common, topical nasal steroid sprays and antihistamines, illicit use of cocaine or solvent inhalation. And then we have vascular abnormalities, such as hereditary hemorrhagic telangiectasia, atriovenous malformation, pyogenic granulomas, neoplasm or tumors, septal perforation or deviation. Lastly, we have hypertension, which is rarely a direct cause of epistaxis, though high blood pressure can make it more difficult to stop a nosebleed. For the assessment, it is important to obtain a detailed description of the epistaxis, including the vital signs, which side the bleeding originated from, and whether it began anteriorly or posteriorly. Asking the patient if they notice the sensation of blood dripping down their throat. So this may help to distinguish between anterior and posterior bleeds. Duration of the bleeds, medical history, medication history, family history, and alcohol and illicit drug use. Next, we have diagnostic tests. So this includes clinical diagnosis, doing a CBC or a complete blood count, nasal endoscopy, CT scan of the nose, partial thromboplastin time. So this is a blood test that characterizes blood coagulation. Coagulation studies such as prothrombin time, activated partial thromboplastin time, and platelet function tests. Lastly, we have BUN and creatinine levels. So here are some complications for epistaxis and treatment. First, we have hemorrhagic shock, pneumocephalus, which is the presence of gas within the cranial cavity, sinusitis, epiphora, the overflow of tears from blockage of the lacrimal duct, hypoxia from impaired nasal air movement, septal pressure necrosis, neurogenic syncope during packing, which is a sudden drop in heart rate and BP leading to fainting. Next is the medical surgical management. So here are some non-surgical management for epistaxis. Cauterization, which is burning the blood vessels with a heating device or a silver nitrate. Applying direct pressure, Little's area, which is pinching the nose with thumb and index finger for at least 5 minutes. Next, we have the Trotter's method, which is the patient is made to sit, leaning a little forward, over a basin to spit any blood and breathe from the mouth. Cold compresses should be applied to nose to cause reflex vasoconstriction. For the surgical management, when bleeding persists despite simple maneuvers, this will require a higher level of interventions. So these are nasal cauterization under anesthesia, wherein an electrical cautery device that has a suction attached is used to cauterize and stop the bleeding. Endoscopic sphenopalatine artery ligation. A telescope is placed in the nose and surgical instruments will be used to dissect out the sphenopalatine artery, which is the common source of posterior bleeds. It is then clipped closed with a surgical clip to close the vessel and prevent further bleeding. So this procedure may be performed in conjunction with packing or nasal cautery. Next, arterial embolization, which is most common procedure for severe epistaxis. A large blood vessel in the groin will be accessed by a catheter. The catheter will then advance up into the facial region. Then an embolizing material is injected into the appropriate vessel to clog it up and prevent the bleeding. Next, the anterior ethmoid artery ligation. So the anterior ethmoid artery has to be accessed through external incision between the nasal sidewall and the eye. Once it's done, we trace back up until we reach the artery, and the surgical clip is placed. Next, the pharmacological management. So we have topical vasoconstrictors. So these act on alpha-adrenergic receptors on the nasal mucosa, causing the vessels to constrict. So an example of this is the oxymetazoline 0.05% Afrin. It is applied directly to mucous membranes, where it stimulates alpha-adrenergic receptors and causes vasoconstriction. This can be used in combination with anesthetics. Next, we have anesthetics. When used concomitantly with vasoconstrictors, their anesthetic effect is prolonged and pain threshold increases. And then we have the antibiotic ointments. So these help prevent local infections and provide local moisturization. It also inhibits bacterial growth by inhibiting RNA and protein synthesis. And last, we have cauterizing agents. So these coagulate cellular proteins, which can in turn reduce the bleeding. So an example of this is the silver nitrate. This coagulates cellular protein and removes granulation tissue. And it also has antibacterial effects. So that will be all from my report. Thank you for listening.